Good afternoon. This is Media Center Ukraine Odesa, and we continue with the discussion of oncology in women. Our speakers are Ihor Kasyanenko, head of the City Center for Family Health, Consultative and Diagnostic Center number 6, and Olena Kolodenko, the head of Center of Primary Medical Assistant number 3. Thank you for joining us today. This is a very important topic as far as I know. According to statistics, breast cancer is the most widespread types of oncology among women. And also in Ukraine, this is like the leader in all tumors. What is the reason for such situation, and what is the general situation in Ukraine? Yes, unfortunately, this statistics is rather sad, but we need to understand that we deal this problem not like once a year, but we as the family doctors try always remind about this issue and make women focus attention on their health. We try to educate them, for them to remember that women's health depends on themselves, first of all. And for that, it is very important not only to make a mammography once a year and refers to specialists once a year, but to do a lot of other things. This is healthy life, physical activities, vaccination. So a lot shall be done by women. But when it comes to breast cancer, we should understand that after 40 years, all women should undergo a complex examination once a year, including examination of breasts, to prevent or to identify at early stages the problems, to prescribe timely treating. It is very important for a woman to address a family doctor. The family doctor will refer her to additional examination, which are free of charge in our state, and women can undergo all needed examinations, and if it's a need to get consultations of an oncologist or mammologist, women can also get such consultations free of charge, which is very important for all women. What is the percentage of women 40 plus undergo examination? The percentage is very low, and we have quite high indicators of breast cancer and quite high numbers. But we try to work and to increase awareness for women to understand the importance of their own health. And as the head of a healthcare institution, we bring to this attention of our doctors, for them actively offer examination of their declarants. Thus, we try to solve this issue from two sides. Do you have any statistics for Odesa region? How many women die of cancer every year? And I would also like to start with some statistics, and my colleague is right when she says that the breast cancer is the first place in women, and on the second place among all oncology cases. The first place is occupied by skin cancer. You've asked about lethal cases. So in two patients with cancer, one dies. So this is first percent. When it comes to the fourth stage, every fourth and fifth patient. When it comes to the whole of Ukraine, every week 110 persons die every week because of breast cancer. And in Ukraine, the diagnosis, yearly diagnosis for 14,000 patients. And the last, and I would like to say that the situation is not that bad. If diagnosis at early stages is 94%, the treatment is possible for the second stage 80%, and the third stage is 50. So, what is my point here? The early prevention and early treatment is very important for this disease. And now I would like to speak a bit about our center, which is a Center of Primary Medical. That is the City Center of Family Health, Consultative and Diagnostic Center, number 6, and we provide services for early diagnosis and prevention activities. We have already examined 6,500 patients since the beginning of the year. The 135 cases of cancer have been revealed, and on the 24th of October, we have this day dedicated to cancer, and it was started yesterday. And yesterday, we found one person with cancer, breast cancer, out of 45 examined yesterday. Just a few words about our center. I mentioned our tasks and services. But when it comes to the equipment, I can say that we offer one of the best digital mammography system of Heliantis company, which is among the leaders producing such type of equipment. We also have the modern ultrasound equipment that helps for the early diagnosis. So we are able to conduct all examination needed for the correct diagnosis. So we have different types of doctors, X-ray specialists, mammologist, gynecologist. And last year, on the 16th of October, there was the day of women health. We were involved in that activities, and we examined 58 women for one day. And we also revealed early stages of the disease. All women 40 plus should be examined once a year. We also work not only with women. Why is it the City Center for Family Health? And of course, we believe that it is important for women to be healthy, but we also provide treatment for teenagers and men. At the moment, we have more than 100 inpatients, and this disease can be found in men. It is related to our environment and hormones which are taken without proper monitoring. Women who are under 40 can undergo ultrasound examination, and if needed, we make mammography. We do mammography. If patients require inpatient treatment, like surgeries, chemotherapy, radiation therapy, we refer them to the clinics of the Medical University and the regional dispenser. You've mentioned that 110 women died over the year. This is an average number, not for this year. And what is the average age of the deceased women? I don't have such statistics, but when it comes to our center, I can say that the cancer is becoming younger. So we have a lot of women under 40. What is the problem? Because children give birth after 30. A lot of women don't give birth. A lot of women just refuse from breastfeeding. How would you assess the prevention level in Ukraine? Because there are a lot of complaints about that. We used to have kind of preventive, proactive examinations, and they helped us in early diagnosis. But now it is not. It is more difficult, and only 20% could be revealed during such specialized examination, because not many examinations are conducted. And just a bit of statistics for our city. For 1,000 people, there are 85 cases of breast cancer, so 850 persons for our city. In Ukraine, these numbers are less, 60. What is the reason for that? First of all, when it comes to climate, then the women love sunbathing, they love to go to the seaside, ecological issues, and many other factors. What is the situation to the access to the medication? Because the full-scale invasion, there were some problems with the access to medication. And I think this question perhaps should be referred to the head of Center of Primary Medical Assistance. When it comes to treatment, those chemical medication, everything is there. Those institutions who have signed agreement with the National Healthcare Service should have all medications needed. And nowadays, I don't see any problem. If women need treatment and they are treated, and if they're treated in oncology dispensary, all medications are there. When it comes to outpatient treatment, and we do not prescribe any specific medication for prevention. It depends on their health, and if women are healthy, there is no need in taking medication. If they are hormone-dependent medication, it is very important to stick to the treatment protocol, not to provoke breast cancer, because there are the cases of breast cancer dependent on hormones. That's why it is very important for treatment. And there are no problems with inpatient treatment as well. Perhaps you have such data, and what is the average value of the treatment? My point is that it is better to undergo examination every year to pay its money for treatment. As for the prevention, it is free of charge, because after signing a declaration with a family doctor, women get an opportunity to be consultant free of charge by family doctors. As many consultations as needed. If these are women 40 plus, then they will be referred to mammography and also to other specialists. This is also free of charge. If there is surgery needed or chemotherapy, then women are referred to specialized institution that should provide everything needed to such women. If this is not the case, these women can complain to the National Healthcare Service of Ukraine, to the Ministry of Health, because if an agreement is signed, an institution, healthcare institution, should ensure full treatment. What about recurrences? Are they often, quite often, unfortunately, and in percentage? I don't have this information at the moment. I can say that after inpatient treatment, and the patients refer to our center or to their family doctors, and we continue examination. And yesterday, the action started, the promotion campaign, which is free of charge for patients. And we cooperate with family doctors. And actually, everything is free of charge all the time, not only during this week campaign. So if they are referred to us through family doctors, then we can just provide them services free of charge. And if there is a healthy woman with no chronic pathology, then examination should be conducted at least once a year. If there are some diseases, or if a woman in a risk group or a kind of serious pathology, HIV, hepatitis, or other hormone-dependent diseases, then these such women should visit family doctors more frequently, from at least 2 times per year, and everything should be free of charge. What could diminish the risk of the development of the disease? And this is, of course, a healthy life. But this is a very wide concept that encompasses a proper diet, healthy diet, physical activity, healthy sleep. And when it comes to breast cancer, when it comes to skin cancer, we should limit the exposure to the sunlight. We should use special substances for that, like creams, just to diminish the risk of cancer development. And the prevention examinations are very important for women 40 plus. And if there is an accompanying pathology, then it could be even more frequently. We should remember that a very important part of women's female health is the protected sex, because in case of a big number of partners can lead to such pathology as HIV, hepatitis B, C, and this is the risk factor for the development of breast cancer. So there are a lot of factors that could diminish or increase the risk of the development of this pathology. Can you remind the key symptoms? When it comes to symptoms, then this is not the early diagnosis of the breast cancer. And it is very important for women to understand this. Before symptoms are there, women should do everything that has been mentioned today. But if women feel pain in breast, some pains and aches in armpits, and she can find something in breast cancer, then this is they should refer to doctor. There could be visual changes on the skin, and if there are some secretions, but this is not the early stage, but we should prevent this before we can see visual changes. And as far as I understand, there are no symptoms at early stages, no symptoms. And if it's an early stage, then we can identify these states without symptoms, which is very important. Have you seen any cases when women have such symptoms and they refer to self-treatment? Unfortunately, yes. And unfortunately, they come to us with the visual form. And I have seen several cases. There have been recent cases. How do they explain that they do not refer to doctors? They cannot explain this. Lack of money, some economic issues, and people don't understand that this is all free of charge. They should not pay for that, and we try to explain this as well. A lot of women psychologically afraid to get bad news, and they wait too long. A lot of women believe to some not traditional treatment, and in most cases they are inefficient, and this leads to the development of disease, to complications, and to some serious consequences. That's why I asked about the value of treatment at severe stages. It is also free of charge if women refer to family doctors, and then they will be referred to all additional consultations, and the inpatient treatment will be free of charge. But in any case, early indication is a critical factor here. And this is not about money. And the earlier women refer, the most effective treatment they can expect. Yes, the state now covers inpatient, outpatient treatment, but early diagnosis is very important because the success is more probable. And since what age women should refer? Any person, regardless of whether man and woman, should be monitored by family doctors. After like 18 plus, this is at least once a year. Under 18, it depends on age when it comes to vaccination, just weighing, measuring height, and some other indicators, and it's very important to remember about that. When it comes to statistics, an average 110 persons die in the Odesa region, and every year. What about rayons of our districts, of our region? We see most cases in the city of Odesa. I don't have information about districts of the region because we have a city center, but the highest numbers are in Odesa. Thank you very much for joining us today. This is an important topic, and I would like to remind once again to men and to women just to take care about themselves and to undergo examination regularly, at least once per year. Thank you very much for joining us today, and we will continue at 2 p.m.